Well, first, I appreciate the invitation to participate. As Roger mentioned, I am a veterinarian. My veterinary career has primarily been serving the swine industry, both in production, in academia, and in the biopharmaceutical industry, including 7 years with antibiotic development. As an independent consultant the past 2 years, I've had the opportunity to work with quite a bit with Global VetLink, providing training and education to my veterinary colleagues out in the field, as well as producers and feed distributors who are using Global VetLink's electronic VFD and prescription solutions. So it's taken me right into the middle of a lot of these guideline issues that we discussed yesterday. What I thought I would start with today on the veterinary side is the first paragraph of the Veterinary Oath that we take upon completion of our veterinary program. And that reads, "Being admitted to the profession of veterinary medicine, I solemnly swear to use my scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, the prevention and relief of animal suffering, the conservation of animal resources, the promotion of public health, and the advancement of medical knowledge." That's the first paragraph of the Veterinary Oath. So some key phrases that I think impact us today regarding antibiotic stewardship. Benefit of society. Clearly not an easy issue. Lots of discussion yesterday, a good panel start this morning. And it requires a perspective of both the macro and the micro environments. I appreciated Dr. Braden's comments yesterday when he mentioned in human medicine the mother of a screaming child wanting antibiotics and the dilemma there at the micro level versus the macro. And believe me, and you heard a lot of that in the last panel, which I thought was really good, there's plenty of those situations in veterinary medicine too. Another phrase was the protection of animal health and welfare. Clearly antibiotics are one of the key tools for health and welfare. But what I want to emphasize as well is to use antibiotics effectively, and this was touched on as well, we must have reliable diagnostics. Diagnostics are critical in the responsible use of antibiotics and in understanding the therapeutic outcomes that will support better evidence-based medicine. My consulting has taken me to China 8 times in the last 2 years, where their swine industry, which is the largest in the world, has an estimated of 1/10 the diagnostic support that we have here in the U.S. Needless to say, the Chinese swine industry has health challenges and is well behind the U.S. in antibiotic stewardship. And I believe it's in part because they don't have a strong diagnostic infrastructure. Thankfully, we are blessed in the U.S. with world-class veterinary diagnostic laboratories. And my one plug, since we are in D.C., my one political plug is if you have any influence on the continued funding and support of those state and government labs, please do your part to make sure they're fully funded. The last phrase that I'll touch on from the Veterinary Oath is prevention and relief of animal suffering. And that was a key question from yesterday. Do we risk decreasing welfare and increasing animal suffering by arbitrarily reducing antibiotics in some situations just because the consumer thinks it's a good idea? I thought Dr. Glisson did a great job this morning on addressing that. And as veterinarians, that is certainly something that we need to wrestle with. I also want to highlight that the AASV, or American Association of Swine Veterinarians, has a judicious use guideline for antimicrobials. And the first statement in that guideline is to implement preventive strategies such as appropriate husbandry and hygiene, routine health monitoring, and immunization to optimize pig health. And Dr. Neeram touched on several of those in his comments. It goes on to emphasize to establish a differential diagnosis list, or if possible, the definitive diagnosis via clinical assessment and diagnostics, and then investigate potential roles played by genetics, nutrition, housing, management, health. And I think we see veterinarians working in all those areas to try to understand what's behind disease rather than just reaching for antibiotics first. Another element of the judicious use policy is considering other therapeutic options. I've had the opportunity to do some work with NutriQuest, an innovative nutrition company based in Iowa, and they're screening some potential immune enhancement products. one of which last year provided a full % reduction in morbidity and mortality in a field trial we conducted. And I know there's many other companies that are working in that area as well. So I think we'll see some other alternatives coming out. Final few elements from the AASV guideline is meet VCPR, or veterinary client-patient relationship requirements, and I'll touch on that in a minute. Use historical outcomes and clinical experience to select antimicrobials. Record antimicrobial treatments, and periodically reevaluate antimicrobial use. So clearly there's stewardship involved in that guideline. I'll finish my remarks with a few key issues that I see for our veterinary profession, and the first one is compliance with new regulations. And compliance comes with both knowledge of the regulations and implementation of them. Dr. Murphy yesterday emphasized that it is the veterinarian that is responsible for a complete and accurate VFD, and that flows right down this table. If the veterinarian doesn't start with an accurate VFD, it's going to be difficult for the producer, and the feed mill is really going to have troubles. Several species segments have not had experience with VFDs prior to this, including poultry, as Dr. Glisson mentioned, and they're on a steep learning curve. I am encouraged that the FDA, the agency's first focus on enforcement is on education. This is also where I think it's important for veterinarians to look at electronic solutions like Global VetLink that can be helpful to enable compliance with accurate VFDs and prescriptions. Another issue is the VCPR, as I mentioned. So there are producers who have not utilized veterinarian services to manage their animal health, clearly. And now, with these regulations, a VCPR will be required for them to access antimicrobials. Yesterday, Constance referred to a veterinary shortage, and I want to clarify that a little bit. It is likely a lack of food animal vets in some geographic areas. There have been 3 new vet schools open in the past few years, bringing the total to 31. I believe there were 21 when I graduated from Iowa State in 1988. According to the AVMA statistics, there's over 110,000 veterinarians. The problem is 1.8% of them are exclusively food animal, 5% predominantly food animal, and 6.3% mixed animal, for a total of 13.1% serving the food animal. We need to influence students to pursue food animal medicine and support colleges like Iowa State, K-State, Minnesota, Wisconsin, Cornell, North Carolina State, Georgia, and there are others who provide special training for specific species. That's the answer for that one. And I'll close by saying that the final issue is collaboration and communication among stakeholders is critical. I think that's why this particular panel is here, and I look forward to hearing from some of the other panelists.